So today I have two young ladies with me, and it is actually a premiere because we're doing something that no one ever has been doing before, which also goes for a lot of other things that we have experienced in our life. Like you and I got sick from long COVID as one of the first people. We shared the same story, and then our passes were meeting. While I was still at the Long COVID Foundation, I arranged one of these very rare treatment slots back then, when there was waiting lists in Kempten in a clinic. You did help apparesis just a few months after I did them in Mülheim. And now we're meeting again, and we're both healthy. And I'm running the clinic with the team here, and you're now a health coach. How did that happen?
Yeah, how did that happen? So yes, we met over scheduling my appointment for the first apheresis, which I first did in Germany, in Kempten, and then followed up in Zurich. And gradually got better, I think in very similar way to you, with infusions, with lifestyle changes. And that sort of leads to how I became a health coach, that I realized that my body can't magically fix itself, but if I give it the right foundation, both in treatments, in food input, in everything I do, that gradually I realized it's putting itself back together, and I wanted to share that forward.
So here's my take, why health coaching is so important. So first of all, when you're looking for treatment, I didn't know anything, and I can see this in a lot of patients. They don't know what treatment is good for me. They don't know that they need clinical nutrition support. They don't know that they need health coaching. But it's also about finding the right treatment, then committing to it, doing it as early as possible, because early treatment is better. But then comes the second step. While they're here, you've seen them, how often they are very anxious. They don't know what to do. In the evening, they're like, oh my God, what's happening with my body? That changes. And then comes, for me, we might agree or disagree on that later on, the most important part. After the treatment, because so many of us fall into that trap of overexerting themselves in the first 2 years. And I just visited Dr. Jäger in Bad Aibling 2 weeks ago, and our guidelines were not to go above 110 in the first 3 months and not to go about 130 pulse rate in the next 3 months. And now she reduced that, and Dr. Aguirre, to 95 to 100 the first 12 months and 100 to 110 the next 12 months, which is quite radical, right? So, that are the 3 steps, and why it's most important, because the most important is not to fall back in my eyes, because you don't want to come every year for apheresis, right? Now, question for you actually. Clinical nutritionist, clinical director, lots of experience by now. How does the clinical nutrition and the health coaching come together? Like, how do you girls make sure the patient gets the best from all worlds?
That's a great question, because we've been wanting somebody like Tanja to join the team, because what we see from the patients that they come and they don't know what to expect, as you said, and they are stressed, they're anxious, and a lot of them, they do travel by themselves. So they need somebody to hold their hand. So having Tanja on board to calm them down, to give them some advice, or to reassure them that everything is okay, it's very, very important, because if you are in a better mental state, then the whole procedure will run smoother. So I'm so glad that you're joining our team, Tanja. Yes.
Perfect. Now, thank you for that. That was amazing input. Next question for you. I have the good part here. I just ask questions, right? What is your approach in health coaching? Because I've seen your approach is so different from all the other health coaches. And I think the main reason is because you're a member of the team here and you also have access to the clinical data. So health coaching on its own is a great tool, and clearly the statistics show that health coaching boosts the results a lot. But now you kind of supercharge it with access to clinical data. That is like being close to being a magician, right?
We hope. It's of course much more data-driven than coaching otherwise can be. We normally only have the data that the coachee shares with us. Sometimes it might be a smartwatch, but generally it's questionnaires, conversations. It does. So coaching makes changes in your lifestyle more sustainable. And for me, it was very hard to understand pacing. Pacing is a really tough thing to first understand, but then even more to apply. It's really hard to get that level right, to always stay under your personal threshold, and it's different for everybody. So
And it's different every day sometimes.
and it's different sometimes every day. You know, what worked yesterday might not work quite today, and to learn that, but also to then hopefully grow out of it or move the threshold upwards gradually, very gradually, and very carefully. I think that's very difficult without the support alongside you. And I was telling Chryso that I always said that I would have wanted somebody alongside, but I didn't know what job title they had. So that's how I found health coaching and then trained in it. And
Yeah, I think it's incredible. Now, if I look back, when I got long COVID, I didn't even know it was long COVID. I first found out when I Googled several, actually months, when I was like, how long can it take to recover from COVID? And then I found Chess Mettinger, who's by now a good friend, and I was like, this is what it's called. And then all the research, how do you treat it? Where do you go? And there was no one, no place, no nothing. So now, 3 years later, if you by any chance find us online or get a recommendation, boom, all you need to do is one phone call, and from there on everything is taken care of. Health coach, clinical nutrition, travel support, the treatment, the after support, the surveys, and everything's data driven, everything's in the medical cloud, everything is constantly analyzed. I must say, without showing off, I'm incredibly proud what happened in the last 3 years, because I would have wished that this exists, right? And now, from here on, it does exist. It's like crazy. Is that the right word?
It's magic.
It's magic. That is a good last word. Thank you very much, girls. I am sure we are gonna do miracles.
Yes, we are.
Or close to miracles. But both is amazing. Thank you so much.
Thank
thank
you.
you.